think that's just, we can make a start, and then as people join, they can kind of catch up with us, can't they? So, so morning everyone, or it's just about good afternoon actually, isn't it, as well? Thank you for taking the time out of your busy days to come to this PPMA webinar. I'm Mark Porter. I'm the head of HR at OneSource, which is the shared service organisation that provides services to Havering and Newham councils, as well as other organisations as well. And I'm your host for the webinar this afternoon. This is just one of a series of webinars from the PPMA that brings you fortnightly thought-provoking topics from a wide variety of speakers. Today we're delighted to be joined by Ross Miller, who's the head of Health and Wellbeing Services at Staff Care Services at the Commercial Services Group. So welcome, Ross, nice to meet you. Ross is going to tell us about the importance of data and how it can be used to inform health and wellbeing strategies, as well as increasing engagement at all levels of the organisation, and how you can draw from a range of data sources and utilise that data to create context and track progress and measure success. So it's going to be talking about moving the discussions on wellbeing from guesswork to informed decision making, and understand those crucial returns on investment as well. So just a couple of housekeeping things before we start as well. Sessions being recorded so that anybody who can't attend today can watch on catch up. But don't worry though, only Ross and me will be visible on the recording. You can keep your camera on if you want to, that's not a problem, but as I say, only Ross and I will be the people that will be visible. So can I ask as well that we all turn our mics off during the presentation, and we will have the opportunity for questions at the end with Ross. But if you want to add questions into the chat as we go along, and we can pick those up from there, moving through the session. So really looking forward to hearing all about what Ross has got to say. So Ross, over to you.
Super. Thanks, Mark. Appreciate it. And afternoon, everyone. Hope you're all well, and weather's treating you well as well, to Mark's point. I'm just very quickly going to put my slides up on screen so that hopefully you can all see those, and we can get cracking. And I'll do a brief introduction on myself before we get started. So Mark's very kindly introed me as head of Health and Wellbeing Services at Staff Care Services. I work for a bit of a complex organisation, which I'm sure some of you have got experience of in your own organisations themselves. But I fundamentally look after the Staff Care Services brand, which delivers a whole range of occupational health, EAP solutions, wellbeing consultancy, and I'm also an MHFA England instructor trainer. So I spend some of my time each week working with individuals up and down the UK, training them in mental health awareness skills. Our Staff Care Services brand is part of the Commercial Services Group. So we're part of HR Connect, the wider HR brand, delivering HR services into local authorities, NHS trusts, and the education sector. So we do a whole broad range of different bits and pieces around people services. So to intro today's session, and I'm really pleased to see a few of you have turned up, because actually as soon as the word data gets thrown into the mix, most people switch off and they think it's going to be a bit of a snooze fest. So I will try and make it as engaging as I possibly can. We're going to talk about how data, all different types of data and information, can be linked to the world of wellbeing, which is traditionally something which was seen as, I don't like the term, but fluffy, a bit ethereal. When it comes to working with people, often data and people don't mix, certainly when it comes to wellbeing. And when I was tasked with looking at setting up a wellbeing consultancy and structured approach to how organizations can address wellbeing strategy and wellbeing initiatives, one of my first focuses was, right, how do we get the information to drive this forward knowledgeably, and make it insight driven and not guesswork? So just to caveat what I'm going to cover today, I'm not going to provide a magic wand that gives you all the answers. But what I hope to do is actually give you a little bit more thought-provoking session on what are the right questions to ask, and what things do I need to make sure that I address with the information that I collect, so that I'm then overcoming a lot of those challenges that organisations face when it comes to wellbeing strategy and wellbeing initiatives. So hopefully that's what you signed up for. Hopefully that's covers what you wanted out of the session, and the proof is in the pudding. We'll see that as we go through today's session. So first and foremost, just to get you warmed up and a bit of audience engagement, and so you don't have to listen to me for 20-25 minutes solid. We came across lots and lots of challenges when working with a whole range of different organisations, from, as I said, local authorities and NHS trusts through to different size education establishments, primary schools, secondary schools, multi-academy trusts. But the challenges that they often faced were similar, but they all faced kind of similar things. So it'd be interesting to find out from you guys, if you could pop in the chat, what sorts of challenges you faced in your own organisations when trying to implement or address well-being within your business. So just to see if they align, really. So I'd be really grateful if you could pop some thoughts in the chat. And then I'll reveal the sorts of things that I came up against, just to prove that the sorts of things that we all come up against are very similar, regardless of the organisation. Thanks ever so much. So yeah, so justifying the work and getting a return on investment is really tough, because often wellbeing initiatives, because they're people focused, it's really hard to measure either where you've started and where you are now, or kind of showing what benefits that work is having. Yeah, so showing the benefits of the work that you're doing, because often it's anecdotal evidence, isn't it? Yeah, demonstrating impact. Definitely one of the key ones. Any others? Getting buy-in as well. So I don't know whether that's, you didn't have a problem getting in buy-in, Mark, or whether there was a problem getting buy-in. So
no,
switching.
So there was no problem getting buy-in from both sides, but it was kind of like they weren't sure exactly what they wanted, and what would be the best way to spend their money. So
like Andrew's put there, switching a focus again. So knowing where to start is often a big challenge. So from transactional work to proactive initiatives, again, I think a lot of wellbeing initiatives in the past have been reactive. So the problems hit and then you're chasing your tail and firefighting to overcome those issues. And management buy-in as well, I think, is a big one. So interesting, actually, to see that the challenges that you guys are facing are no different to the challenges that we were seeing in the organizations we were working with. So it doesn't matter. I think it's a really important distinction to make. It doesn't matter what type of organization you work for. Ultimately, that organization it contains human beings, and human beings all face the same kind of challenges and all have the same sorts of questions. So having a person-centered approach to wellbeing is really important. But to address some of those challenges, or to describe them, these are the sorts of things that we came up against. Getting buy-in, which you've all said, but not just buy-in at a management level, because ultimately a lot of these initiatives require resources or money. And often the people that hold the purse strings want to show that there's a return on investment. They want to show what impact the money that they've invested, or the resources or time that's been invested, is having on their organization. But don't forget that you need buy-in at all levels for wellbeing initiatives to truly be impactful. That's not just at the CEO, director, shareholder level, but also at the worker bee level, at the level of the individual, because ultimately it's often those people that not only have the most insightful ideas, but they're the people that are most heavily impacted by the changes or the focus of those wellbeing initiatives. So buy-in at all levels was a real challenge. To a point made in the chat, knowing where to start. The world of wellbeing changes. I sometimes think it changes on a daily basis, but it definitely changes on a regular basis. So knowing where to focus efforts and making it proactive and not reactive is a big challenge. Evidencing progress. So drawing a line in the sand and then being able to say that we've improved is a real challenge in something which focuses often on people's thoughts or emotions or perceptions. And again, this is where data can come into play when we talk about wellbeing, because if you get the right information at the right levels from the right people, then you can start to evidence progress. Now, a challenge that we came across that we looked to try and address, and this happened more and more often, was the one and done mindset, or the tick box mindset, where organizations would say, well, we feel like we have to do this, so we're kind of doing it to tick the box. or we're going to do it once because that's what we feel like we have to do, when in fact, actually, to truly make sustainable change, you've got to take a continuous improvement approach, so a cyclical approach to well-being, because just because you've done it once, it doesn't mean that the issues or the things that need to be addressed go away. So again, the challenge of getting people out of that mindset of a one and done was something we had to overcome. And lastly, and for me as a huge advocate and trainer of all things mental health, for example, breaking down barriers using information was key. So ensuring that the cultures within organizations actively support conversations around difficult subjects. So whether that is things like the menopause or suicide and self-harm or eating disorders or racial stereotypes, all of these sorts of things all really hugely impact people's well-being, but they're also things that often people find difficult to talk about. So through information and engagement and knowledge, we can start to break down some of those barriers and overcome some of those challenges. So really interesting to see that whatever organizations you work in, facing the same sorts of challenges as we've been coming up against for several years, regardless of the size of the organization, because fundamentally those organizations contain people, and people all face those same sorts of challenges. So as I said, data was what was driving, trying to address some of those challenges. So in order to start to understand, right, how are we going to overcome some of these things, we needed to get a bit of a handle on the fact that there are different types of information. And dependent on the role that you work in and your particular kind of focus, you'll lean more towards one end or the other end of the scale. And actually, it's important to recognize that in order to get a truly effective wellbeing initiative and strategy in place, you need to use a whole different range of data types. So we look at it from macro to micro. Macro being the broader reaching types of data. They deliver us, or they provide us with different types of information to the micro data, which is often focused on either the individual idea or the individual person. So to step you through those, again, this is about kind of getting you thinking, where do I get this information from and how might I use it? Our macro data is stuff like our global trends, our national trends, our demographic trends, much bigger, broad brushstrokes of information. But this type of data enables us to provide context to the work that we're doing, maybe at an individual or an organizational level. So not to be overlooked in its value, but it often links into things like our strategic goals, our 3 or our 5 or our 10-year plans. The macro data is really important when we look at that sort of stuff. So to give you some good examples of where you might get that sort of information, and I've actually included links in the slide deck, which I know Grace very kindly will share after the event, are things like the OECD, which is the Organization for Economic and Cooperative Development. So they have global data sets for mental health and well-being, for equality. So the sorts of things that we're looking to address within our organizations, but they look at it on a global canvas. So really good from a contextual perspective. Organizations like Aon have undertaken global wellbeing surveys, which link into businesses of all different sizes across 41 countries. So again, contextually, it gives us good context and good benchmarking and comparators to see how am I doing maybe versus other organizations, or what problems are they facing that I might need to address within mine. I'm sure you're all familiar with the ONS, the Office for National Statistics. So again, not to be overlooked at a macro level for information on finances, relationships, education, skills and societal pressures. So again, they collect huge amounts of data that can be fed into our strategies to look at trends, to try and address some of the things that we might see at an organizational level. So again, I will share links to all of those good reports and kind of sources of information that you might want to feed in at that macro level from a strategy perspective. Then as we start to work our way through, the data gets a bit more focused. So we then start to think, hang on a sec, we need to look at this at an organizational level, for example, or a regional level, if we're a council, or within a county or within a town or an area. Or we might want to break it down into particular areas of focus within wellbeing. So I'll talk a little bit about how we do that in terms of our pillars of wellbeing. So the next level down is starting to narrow our focus, possibly still quite broad, but way more focused than global or national levels. So this often requires, as we start to go through and get a bit more focused on the types of data, this often then starts to require some engagement with individuals. So from an organizational perspective, often that engagement is at the top table, at the top end. So that's the CEOs, directors. You tend to get a perspective of how they believe the organization is addressing well-being. Now, interestingly, that's often at odds with when we then get down to the micro level, the individual employee, what they're saying the organization is doing with regards to well-being. So it gives us an opportunity to apply context and comparison using different types of data. So they're both valuable, but for different reasons. So we start to work our way through a little bit more focused. We then might look at more local data, so team or department based. This allows us to get some more nuanced information, for example, for teams that work out in the field versus teams that work in an office environment. Teams that do different roles might have different requirements. So again, our focus is starting to narrow down. And the only way that we can get that element of focus and be proactive, so one of the points in the chat, is to collect the relevant information, to ask the right questions. But at that lower level, that getting towards the micro level of information. And then lastly, you've got the individual or feedback element. So that is the opportunity for one person to give their ideas or their feedback. And at that micro level, that's often where we generate actionable ideas. So that is somebody coming forward with an idea because it directly impacts them or people like them. So again, collecting that data is often an exercise in engagement. That micro level is going out to the workforce and collecting that data, that information, and then feeding that back into something that is actionable. So it's really important to recognize that there's lots and lots of different levels of data when it comes to wellbeing, and they all have a value, but they all need to be applied in slightly different ways. So we were finding that we were collecting lots of information on behalf of all different types of organizations, and we were getting too much. And actually, we needed to start to address, does this data actually serve a purpose? Does it address or deliver something? And we split it down into an ABC approach. So again, this is about asking the right sorts of questions. And if your data doesn't address one of these areas, then you have to start questioning what's its value, what does it give us? So to do this, we split it down into nice, easy chunks. So is my data actionable? Can I do something with it? Does it provide me with the ability to form an action, to be proactive? Does it make me accountable? So if I've gone out to my staff base, they're expecting me to do something with that. Does this data enable me to be accountable? Does it provide me with the information that I need to do something achievable? And that's really important, because as organizations, we're really good at setting 3, 5, 10-year strategies, when in reality, we know the landscape of wellbeing changes very, very quickly. So actually, we need to set initiatives that are achievable, often in the short to mid-term, that help us drive forward to a much wider or broader strategy or a goal. And does that data enable me to be agile? So I know I'm focusing in this area now, but when I get new data, do I have the ability to be able to change my focus because the requirements have changed, the wider staff-based requirements, the economic environment that we're working in, the physical environment that we're working in has changed. So again, we ask ourselves these key questions to make sure that the data we collect is addressing key elements. B, does the data I collect enable me to get buy-in? Does it enable me to get buy-in at the top to enable us to get the right resources and funding? Does it enable me to get buy-in at the bottom of the pyramid to collect that data, to create engagement, etc. So actually, really important question to ask is, does this enable me to get buy-in? Does it create a baseline, a line in the sand from which I can then measure my progress? Does the data provide me with a benchmark or context? Have I got too much of it? Am I getting bogged down in it? If you're getting bogged down in it, then you're probably not asking the right questions, or they're not focused enough. So it's about having a rethink of am I collecting the right information? And then lastly, is this information enabling me to communicate effectively? Am I talking to the staff base around my actionable initiatives? Am I being accountable and communicating that out? Nobody wants to provide feedback and information to a business and then never hear anything back around what's being done with it, because the next time you ask those same questions, you'll get less engagement. So communication is really, really important. Doing that consistently as well is really important. So making sure that you can keeping momentum. Providing context, so asking, giving people the reason why you're asking these questions, what you intend to do with it. And then lastly, that continuous improvement piece. So recognizing that this is not a one and done exercise and communicating that out to the staff base. And that's where we developed actually a 360-degree approach to wellbeing. And I've, being honest, stolen this from an ICT approach or a standard continuous service improvement model. So looking at a 360 approach is really important because it removes that mindset of I'm doing this to tick a box, I'm doing this once because I feel like I have to. So actually, if you agree on your structure, what structure are you going to approach wellbeing with? What questions am I going to ask? What information do I need to collect in order to inform my strategy and inform my initiatives? I then collect that, asking the right questions, creating a baseline. So getting some facts and figures around this subject, which is traditionally fluffy and a bit difficult to measure. Agreeing on the actions which are driven from that information. So maybe assigning scores to the responses that you've got, percentages or marks out of 10, which give you a line in the sand, a day zero line, which then enables you to track the next time you run this process, whether you've improved. But communicate this to everybody. Be honest about what those scores are, but also be honest about the fact that you're taking accountability for them and it's being driven by the information that's been collected. And then lastly, review those outcomes. So run those initiatives for 3, 6, 9, 12 months, however long is necessary. Review the outcomes, recollect the data and compare the first set with the second set to see actually whether there's been improvements, to see whether some of those scores have slipped and that you need to change your focus. So it's, again, coming back to that agile piece. Has the landscape of the world changed? And to give an example of that, wellbeing doesn't stand still. Who'd have thought 2-3 years ago we'd be having conversations about COVID, which then created a mental health crisis, social isolation, decreases in physical wellness because people were not leaving their houses for periods of time. Significant change both in the way that we operate personally and professionally in the workplace. Huge impacts on long COVID. That landscape didn't exist 3 years ago. Now, fast forward to today, quite a lot of us are not talking about COVID anymore. We're talking about the financial crisis and the impact on financial well-being. So again, the landscape of well-being and the focus that we need to put on it has changed. And the only way that we can ascertain that is by making sure that we have the right feeds of information coming through into our strategies and feeding through into the initiatives, the support that we put in place for our workplace. And then it's estimated in 2024 that actually it's going to change again. And we're looking at things like quality of lifestyle is going to take a significant decrease because actually things like the squeezed middle, the middle earners who traditionally wouldn't be brought into the conversation are now being impacted because of the financial crisis. So our landscape is going to change again. And the only way to continually address this is the 360-degree approach. So being agile is really important. So we take a 4-pillar approach. You can have I've seen up to 15 pillars, but for me, I keep it simple. This enables the organizations we work with to make it really manageable and understandable. We take a 4-pillar approach to wellbeing. So all the data we collect, the questions that we ask align to one of these pillars, and it enables us to track progress. So having a structure that we can hang our hat on and repeat is really important. It also allows us to benchmark where we are on day 0 when we start this process, and to show that we've tracked growth in each one of those areas. It also enables us to see maybe if there's a particular pillar or area of focus that we need to concentrate our efforts on. We might have some great stuff in 2 of the pillars, and we might need to pull our socks up in other areas. So breaking it down into something that's structured and repeatable, and asking the right questions is really important. So you can see that we're starting to address a lot of those challenges that came up originally. So lastly, before I close the session down, because I appreciate it's a lot of me talking, I just wanted to engage back with you again and talk about the thing that I feel most passionate about, which is the breaking down of barriers. And the best way to do this is through the sharing of information and the collection of data. And it's about shining a light sometimes on marginalized groups or groups that might struggle with their well-being for a whole range of different reasons. And data is invaluable in this. So I use the term quiz quite loosely, but I'm going to ask you guys to put some answers in the chat, some of the statements that you see on screen there. And then I'll reveal the answers to these. And some of these you might be familiar with already, but I'm hoping they shine a light using information and data on some key subjects that we might want to talk about. So in the UK in 2020, there were a significant number of deaths by suicide, for example. Has anybody in the chat got any idea what that number might look like? Just throw a number out there. Any thoughts? You might know what the figure is. Too many. I think that's probably a very good place to for 10,000. Okay. So interestingly, you've highballed it there, Mark. There's actually 6,749. It's estimated that could be under recorded by as much as 25%. So you could be up near that 10,000 mark. Now, I always, for context, because remember, context is really important in these conversations when we're talking about data, I always put this next one up, which is there were actually 1,752 deaths by road traffic collision in the same time period. I find that quite a stark comparison, that I would imagine most people could name an initiative that talked about road traffic safety, but most people couldn't do the same for death by suicide. So having this information, this context, this data enables us to open up conversations about some quite difficult subjects. The next one is Black people are significantly more likely to get a community treatment order if they've previously received treatment under the Mental Health Act. Any guesses on how many times more likely they are compared to a white individual? Any takers? It's 8. Oh, 70%, 5 times, 7. No, okay, we've got a few. 3. It's actually 8 times more likely. So an individual is 8 times more likely. So again, using the information and the data that we have, we can start to see that a marginalized or a minority group is treated very differently when it comes to well-being versus others. LGBTQ individuals who access the health service, 1 in 4. 1 in 10 tried to get help and couldn't. So again, we can start to see with data that there are, again, minority groups that are struggling to get the support and help that they need. And lastly, I have an autistic son, so this one hits hard, is 80% of adults with autism have at least one mental health condition. So again, we can start to see that with that information, we can potentially start to address barriers and inform conversations that maybe we didn't have the knowledge or the information to do so beforehand. So I will end my my discussion on that just to kind of say that data can be incredibly powerful. If we collect it and we ask the right questions, then it can truly inform both our strategy, but also our proactive initiatives across our organizations. More than happy to field questions. There's a summary of the sorts of things that I've talked about today, which will be shared in the slide deck. And for those of you that want to connect, I'm on LinkedIn. I'm more than happy to have conversations around the data that we collect, the initiatives that we run. If anybody is interested, then my details are on screen. So if there's any questions, happy to field them. If not, then thank you for listening. Over to you, Mark.
Yeah, no, that's fantastic, Ross. Really, really insightful presentation. I'm a bit of a data geek as well, so it really hit all my buttons too. Yeah,
good stuff.
I do. I love numbers and figures and things. So yeah, any questions for Ross? If you've got questions, then unmute your mic and let's ask those out. I mean, I'll start. Well, I've got a question here, though, or a couple of questions, Ross. So, I mean, I really loved your whole piece around the sort of the person-centered wellbeing approach that you talked about there, and those comparative data sources, because I think they really give really, really good insight into the places that people can sort of go and get that kind of information. And I love that, the idea of this work not being fluffy at all, because you're absolutely right. That's the kind of thing of, oh, well-being, that's, it's a fluffy sort of area. And it totally isn't, because the impact in terms of sort of lost revenue and staff time and resource time is is enormous. So it absolutely is not a fluffy area. But just wondered if you could give us a couple of examples of you talked about impact there as well, where some of the work that you've done has actually sort of made an impact within a service or an organisation that you work with, Ross.
Yeah, of course, absolutely. So to your point, Mark, just around the figures, there's two figures which stick in my head, but they're quite hard to get your head around, first of all, because they are so large. Is that it's estimated 72 million working days a year are lost as a result of poor mental health in the workplace. And that equates to £42 billion in lost revenue and resources. So there are huge numbers to comprehend, but they're worth sharing because of the impact that it has on the national economy. In terms of the work that I've done, definitely where we've seen the biggest impact is the level of engagement that we get with the more general staff base. The hardest barrier, or the first barrier to overcome, is the engagement at the top end of the table, as it were, getting people to buy in and spend some money. Once we've overcome that, the next challenge is then getting the rest of the staff base, the other 99% of the people within the organization, to engage in the work that's being done, and to show that there are demonstrable benefits to engagement. And the way that we do that actually is by sharing the information and being open and honest about it. An organization kind of has to live and die by the fact that they want to make this better. And one way that we do that is we ask an organization to self-score. So we say, okay, fine, where do you think you are? And then we will engage with the general staff base, the populace, as it were, and we get them to benchmark using the same question, and we see where the gap analysis is. And actually, it shines a light on the fact that some organizations are in touch and they've got a good culture and they are kind of doing what they say they think they're doing, and others are so far removed that we have to try and bridge that gap first before we can then start to, it's about culture piece as much as anything else.
Yeah, that's fantastic. Thanks for that, Ross. Carola, apologies if I've pronounced your name wrong.
You haven't. Thank you, Mark. Thank you very much, Ross, for that. That's really interesting, and I'll definitely link up on LinkedIn with you. It seems like we're actually colleagues to a certain extent, because I deliver workplace well-being, and I absolutely love data, so I'm completely with you, Mark. We see the difficulty to get with a topic like well-being to the upper management when they say, "Oh, this is just fluffy stuff and we don't need that." But I think I usually run a staff survey which asks a couple of uncomfortable questions, So obviously it's fully anonymous to make sure that people are honest with me. So I only collate the data and the answers, but never an email address or anything else which is related to that. So things like, are you feeling looked after by your company?
We do the same.
And then I end up walking with a set of data and said, hello, Mr. MD or CEO, here's what your people are actually saying.
Yeah.
And this is what we could do about it.
Yeah,
and I think it makes a massive difference to not only ask, well, in my case, because I'm a nutritionist and fitness instructor, I always talk about diet and lifestyle, obviously, but it's about asking those questions where we're normally shying away from. And because it's anonymous, we have a chance to get a really honest and clear picture where people challenge not only the company, but sometimes even what I'm going to tell them, because then sometimes people say, well, you're only talking about weight loss. And I said, well, I never talk about weight loss because that's an individual topic. It's not a group topic, and those sorts of things.
Yeah,
and
absolutely.
I think it makes a big difference if we're asking the difficult questions as well.
I agree. Yeah, absolutely. We take a similar approach. We ask the staff base a lot of questions structured in a repeatable way. But actually the magic happens when we take those answers, again, anonymous, and we apply some we apply some trends and some kind of follow-on questions and analytics to it, which would then demonstrate to the organization that if your staff base is saying this is the likely outcome of what's going to happen with that staff base. So these areas are disengaged, or these areas are likely to work but do it in a disgruntled way, or you know,
exactly.
So actually you can start to demonstrate to a business that the way they've answered will create follow-on actions and opinions. So yeah, really powerful. But the only way you can do that is get that level of insight by asking, as you said, those difficult questions.
Thank you.
Thanks.
That's great. Thanks, Carola. And any other questions from anybody, or any insights or thoughts that people want to share? Stephen, you've got your hand up there.
I suppose my question is about measuring the impact of an initiative or an action you might have taken, and it's that issue around cause and effect, I suppose, because obviously you can when it comes to well-being, you can never really say that, you know, because I've introduced some training or mental health first aid or whatever it might be, and I've seen an increase in my staff survey scores or my sickness absence or whatever the data is. It's always difficult to say, you know, that's because I've introduced that particular initiative. And I just wondered if you had any thoughts around that. Do we need to look at, for example, those 4 pillars as an example that you gave, look at them more holistically rather than trying to look at single actions and single pieces of data and trying to draw conclusions? It's kind of what's the best way of demonstrating that return on investment, and that the initiatives you're putting in place actually are making a difference.
Absolutely.
If that makes sense.
Yeah, no, it does. It makes perfect sense. So the core data set that we use provides it's getting up towards the macro level in the first instance. So it gives us broad brush strokes across the 4 pillars, for example. We then ask a whole series of questions, individual questions, which we can then track response rates on. So therefore we start to get down to the micro level to address the more specific areas. But also if you take something like mental health first aid as an example, we actually anonymously log the conversations that we have within the different areas of the business. Not to say that one particular individual or one particular team is having more engagement than another, but what it enables us to do is say, so to give you an example, in our business alone, we took 250 calls within a calendar year for peer support. We can then evidence back up to the senior execs to say, the investment that you've put in place has meant that these 250 conversations wouldn't have happened beforehand because we didn't have that initiative in place beforehand. We've also been able to see that changes that you've made in the business, either restructures or changes in management or approach or strategy, have had a significant or not significant knock-on effect on the peer-to-peer support that's been input. So sometimes, again, we take a holistic view but the only way we can track the impact is by looking at that narrow focus again, and kind of focusing on initiative and an initiative at a time, and seeing what impact that's had. And then having the realization that some things are not going to work, but overall we need to have made a positive impact. And it's getting out that mindset of I'm doing this just to make money or to improve the efficiency of the business. Actually, it's those other knock-on effects, the culture piece, that individual, that team, or that organization's sense of togetherness and collectiveness and self-purpose, and getting value out of the work that they do. These are all as equally as important as just the figures on the bottom line, as it were, which again, to your point, is quite hard to track, isn't it? So.
Okay, thanks for that, Ross. Any other questions from anybody or any observations there? Okay, if not, I'll bring things to a close. So thanks everyone for making the time to come to the webinar this afternoon. And thanks again to Ross for an excellent presentation. And I know that's certainly given me a lot of food for thought, things that we can take back to my client councils that I work with, and I'm sure others will have had that too as well. So thanks, Ross. And Ross again has kindly put his contact details there for people, so I'm sure Ross will be getting connections from people as well. Just a couple of quick plugs before we go. So nominations for the PPMA awards are out at the moment, and the closing date for entry to those is Friday the 27th of January, so plenty of time to get an award entry together. And there is a category for best health and wellbeing initiative as well, so just saying, so that's well worth putting in an entry. Tickets are also now available for the PPMA conference in Birmingham, and that's on the 26th to the 28th of April next year. So early bird tickets are on sale now. Prices go up nearer the nearer you get to the conference, so best to buy your tickets now. And if you've never been before, it's definitely worth going, and really, really good value for money for an event of this size. As I said earlier, this is just one of a series of webinars from the PPMA. Our next webinar is on Friday the 13th of January at 12 o'clock again. And our speaker will be Dr. Sabrina Robinson, who's the Wellbeing Lead at Essex County Council. So I'm sure you will want to join that webinar as well. Thanks again, everybody, and thank you, Ross, and see you all soon at another PPMA webinar or at an in-person event. Thanks very much. Have a good weekend, everyone. Bye.
Thanks, Mark. Take care.